So welcome to the Dr. Paul Show. I'm Dr. Paul, and I have the pleasure of introducing Linda, who I've actually known for many years. Over 10 years ago, she was a patient, and I think I had her on medication. She was doing well. Then she was seeing another doctor for a while who was refilling it for her, and then she recently came back to my life. So anyway, Linda, if you could kind of just tell us everything about your life that you want to share about, before, when you started seeing any early signs of any issues. So.
Well, I was in graduate school, and for those 3 years it was really stressful because I had 3 little babies at home. And finished graduate school, then came to Capistrano Unified School District and was employed as a speech pathologist. And so it had been a relatively stressful 3 years, and then to start a new career, that was also, again, pretty stressful. So I just felt after, and it was a couple years after I had started employment, that I just felt kind of low, and I didn't usually feel like that. And I really felt like I was dying. And I remember coming to you, and
How old were you then?
38. And that's when I first started seeing you. So it's been like 35 years.
Right.
And so I came to you.
You probably saw me very early in my
Yes.
practice. Yeah.
Yes. And my 3 little babies came to you.
Yeah.
So
This is back when I used to be a family doctor for a decade or so before I started doing this full time. So.
Yeah. So that's when I found Dr. Corona. And I just came in and I said, I think I'm dying. I think there's something wrong with me. Please check me out and just tell me what it is. And so you ran some tests and came back, and you said, you're not dying, but you're premenopausal. And so I didn't realize that was really happening. And you said, let's try you on some medication. And I said, no, I don't want to get on medication. I'm really strong. But what had happened, the behavior change that I had noticed was that I was screaming at my kids. And I'm not a screamer. I don't behave that way. But it's like I just couldn't take, what was going on. So first I said no, and you said, okay, you think about it, and this is not anything that's your fault, that you're doing wrong, but there may be a brain kind of imbalance with your neurotransmitters, and if you want to think about it and come back, if you don't, that's okay, that's your decision. So I went home and I screamed at my kids for 2 more weeks, and not that they were doing anything horrendous, but my tolerance level was so stressed out. I was just beyond myself. So I said, okay, I'm going back to Dr. Corona, and I'm going to try this. And so you did. You put me on some, I think right away, you put me on Effexor. And I noticed it impacted me within the first 3 days. And all of a sudden, I felt so much better and could tolerate little things that were going on at home. And my work started evening out, and my moods started evening out, and I wasn't like this. And so it changed my life. It changed how I responded to my kids, to my mom. Just my behavior just became much more like it used to. It didn't change me at all, but it just made me feel like I used to feel.
Yeah. Back when, I mean, because I asked my patients this question a lot, like, when did you feel your best in your life? Where would you say that would be?
You mean what stage in my life?
Yeah.
I felt really good in high school, and I felt really good in college.
Grad school?
Grad school
when
was
it kind of
so
started.
stressful, and
Yeah.
by then I had gone through a divorce.
Right. Okay.
And so I had 3 kids and knew that I needed to pursue a profession. And so I had decided, because I had a degree in communicative disorders, that my fastest way to get into a profession would to pursue that. So, and that was in the field of speech pathology.
And grad school is not easy either.
No.
It's not an easy task.
No, and it's science-based, and it's a lot of memory, and I would just have to shift gears. And I was driving an hour and a half to get to school, too. So in the car, I would turn a little switch, and I'd say, okay, now I'm a student. And so I'd think about my test that I was going to take or whatever was going on at school. And then on the way home at 8 o'clock, I'd say, okay, turn a switch, okay, now I'm mommy. So I had to compartmentalize my 2 lives. But that was stressful. But, I learned if I could do that, I could do anything.
Where do you remember, as far as your family history, mom, dad, who might have had like an anxiety disorder or some depression?
My dad might have. My dad might have. He drank heavily, and but he was always functional. He loved golf. He spent his life out on the golf course, so he wasn't too impaired to be able to, and he was really good. So he could have been too impaired.
Yeah, but the genetics sets you up for it.
Yeah.
I mean, there's 3 main things. The genetics can set you up, and then if you look at his parents or your mom's
That's
parents,
right. His dad.
You're going to see alcoholism. You're going to see even functional alcoholism, meaning that someone's drinking a little maybe too much. They're self-medicating something. They're trying to suppress their feelings, suppress their emotions.
And then my dad's dad. He
Yeah.
had a history of alcohol, so
Right.
it
Right.
goes in 2 veins in both
Right.
sides of the family.
Right. And when I saw you, you were kind of probably late teens, early 40s, or late 30s, early 40s, and I call it like pre-menopause, or pre-peri, which is maybe at least 10, 15 years before menopause. But what I've found is women, when they get to the late 30s, early 40s, start having some changes happening. Some women notice a change in their cycles, but some don't. But some people have a little bit of hot flashes, and they're like, wait a minute, am I menopause? No, you can have a little hot flashes in your early 40s even.
But I had no idea there were no signs of any of that. So I was very startled when you.
Right.
Yeah, I was surprised when you told me that.
And when you saw me early on, and early in my practice, in the early 90s is when Effexor first came out, and it was the first of its kind, because we had 3 SSRIs at the time working on serotonin, which is Prozac, Zoloft, and Paxil, and then Effexor came out as the first SNRI, which balances also norepinephrine, not just serotonin, and that was the breakthrough for me that really got me understanding the subject. So when I started seeing people suffering like you were, emotionally, physically, Effexor was just like a miracle drug. It really was, and that's what I called it back then. I called this the miracle drug. It helps so many things, and that helps people emotionally, helps depression, helps anxiety, it helps the body aches and pains. So, but yeah, I think with the combination of genetics and being at that age, that's the combination is what set it off.
Yeah.
Yeah, and it's something like you said, you couldn't help. It's unfortunately, way too many people ignore it and try to push aside. No, I'm strong. I can get through it. And people suffer when they really shouldn't be suffering.
Yeah.
And plus, a lot of people, like when you first came in, I don't want to take medication. That I did, and sometimes it takes a lot of talking people into things. For me, I mean, I have to explain it. I have to draw diagrams like I do on the show. To explain, like, look, this is what I think is going on in your brain, and this is fixable.
Yeah, right.
So you were on Effexor for several years. I think you were seeing Dr. J for a while. And I think when I saw you again, after 10 years you came back to see me again. And you were on Effexor XR 300 milligram, which is the maximum dose. And when you saw me, you'd gone up to 450, and you felt better actually.
Mm-hmm.
You told me
because I was living in Oregon and I was feeling just a little bout of down.
Right.
And I thought, well, I'm far away from Dr. Crone. I'm not going to be going to California for a couple months.
Mm-hmm.
I'll just try another
yeah.
dose of the Effexor and see if that does help. And it did.
Mm-hmm.
But I wanted to check with you to see if that was the right direction.
And I told you it's okay, it's not the best, because usually the max dose is 300, and you would have been at 450, and that's what I did is I lowered that to 300 and added Wellbutrin.
Mm-hmm.
Because what was missing from the Effexor was the dopamine. And so and I'll explain this. I can explain this a little bit later on my whiteboard. I'm going to explain how this works. But basically, Effexor XR, when you get to the higher dosage, it balances serotonin, norepinephrine. It does balance dopamine a little bit.
Mm-hmm.
I call the pleasure chemical. It does a little bit, but not as well as Wellbutrin does. So what I did is I lowered it to 300. I added the lowest dose of Wellbutrin, which is 150,
mm-hmm.
and then you felt better.
Yeah, I mean, within a couple days,
Right.
I felt a big difference. I felt like I was back to who I was.
Right.
I wasn't depressed.
Right, exactly. So but I predicted it would be pretty easy with you to figure this out,
mm-hmm.
so because you had done so well for a little while. So the fact when people say to me, I was doing so well, and now something's wrong, and not quite where I was, then something chemically is not right,
mm-hmm.
And I was pretty, like I said, it was pretty simple with when I talked to you about what to do,
mm-hmm.
and since then you've been feeling great.
Yeah.
And you'll continue to. I don't anticipate we're going to probably need to make any adjustments. I mean, might we increase the Wellbutrin later? The only reason to increase it later is if you start to find that you're doing well, but all of a sudden you start to dip again. So if you're starting to dip again, I wouldn't increase the Effexor. I would double the Wellbutrin,
mm-hmm.
up to 300, which is a more average dose. But with being on a higher Effexor, you may not need that much Wellbutrin.
Mm-hmm.
So I think as long as you're feeling good, we're just going to leave it where it's at.
And these are average doses?
Yeah. It's the highest dose of Effexor. It's the lowest dose of Wellbutrin.
Okay.
So with my practice, I combine. I'm a combiner, so putting things together is what I do.
Mm-hmm.
And that's another difficult part of my job is telling people, I don't want to take two things. I want to stay on only one thing. But I think with you, since you already understood for the last many years that these medications help
mm-hmm.
you.
Because I've asked you, what would happen if I stopped? I think I want to try stopping. And I think we tried it for
bad idea.
A little while. And you said, your brain is your brain. And you could try it, but my guess is going to be that your brain is going to start signaling to you that it's missing something.
Right.
And you need...
Did you try it?
I did.
And?
And, not that I hit the skids, but, I was only willing to try it a week or two, and I said, no, my brain needs this.
Yeah, and there's nothing to be ashamed of. I mean, when we say the brain needs this, we're not talking about an addiction need. That's not what this is about. You can't
mm-hmm.
get addicted to these medications.
Mm-hmm.
And people might say, well, how is that the case? Because if I stop taking them, I'd feel terrible. Well, again, there's a lot of things in medicine we give that people take longer term and they don't think twice about it. Like
mm-hmm.
like thyroid supplements for low thyroid, you take that lifelong, and no one questions it. No one tries to go off of their thyroid because they know that it helps them.
Mm-hmm.
If they try to go off the thyroid, they're tired, they don't feel good. And if you go off your blood pressure medication, your blood pressure goes up, and but you're not going to tell the blood pressure patient that you're addicted to your blood pressure medication. No, that's just you have a medical condition that needs treatment.
Yeah.
When it comes to the brain, since we don't have a number to look at with the blood pressure, we don't have a blood test to look at like thyroid, it makes it look like it's not as real.
Right. Mm-hmm.
But the brain functions, and we know how the brain functions, and we know about how these imbalances. So all we're doing is making the chemicals go the right way, not the wrong way.
Mm-hmm.
They were going the wrong way before, and these medications are going the right way. So there were just really three chemicals that were off in your brain, and this combination really fixes all three.
I've always thought that stress brought this on.
It can.
Do you think that's the...
It's mainly genetics sets you up
mm-hmm.
for it. it's the hormonal changes that make it worse, and that's what set it off in your case. And the third factor is stress, and so stressors and trauma can play a role too, like PTSD. So some people have no genetics, no anything, but they're traumatized. You know, I talk to a lot of veterans. I see a lot of people with PTSD and treat it, and you know, and the trauma, the extreme of what they've been subjected to on the battlefield, and what they've seen, and what they've, you know, and you know, we've talked to people. It's pretty horrific what they've gone through.
Yeah.
Trauma can do it, and trauma can be also like childhood trauma. We talk to people on the show who have very sketchy childhood. Their parents were very unhealthy. You know, bad upbringing, alcoholic parents.
How about ADHD?
Well, ADHD, well, that's also genetic. Yeah, that's also a genetic issue.
Could that be a trigger?
What's that?
Can that be a trigger?
It can be. Yeah, it can be.
Because it can cause somewhat, depending on the person, some trauma involved.
Yeah.
With that.
Yeah. Yeah. So yeah, but people, you know, have emotional, physical, sexual trauma growing up, you know, that's a bad way to start life, and that can set up for that, and you know, and so that's why, you know, so there's different factors that lead to this, but you know, but those I call the big three right there, you know, are what causes this, which is, you know, really all three of them you have no control over. You can't control your genetics. You can't control your hormones. You can't control what the stresses you go through with life, because stresses happen, you know, to a lot of people.
Yeah.
You know, and but what with being on what you're on now, when stresses happen in your life, which they do, you're going to be able to handle it better. You know, but you're going to still care, but you're going to be able to, you know, be able to handle the stress that you're under.
Yeah.
You know?
I found out not too long ago. My daughter didn't tell me for a while, but she's taking medication for anxiety.
Yeah. Yeah, and these medications like Effexor XR, you know, works for depression, works for anxiety, works for body aches and pains. I use Effexor, you know, more modernly. I use a lot of Prestige, which is basically the same thing as Effexor, and Cymbalta. You know, so these are all the same, the family that I really love the most as far as working with this family of medications, because they're the most complete. Like Effexor, it's the most complete medication that we have as far as the depression and the anxiety at the same time. So.
Yeah, she has more the anxiety than the depression.
Right. But they really work on both. The Wellbutrin, which I just added, works more on the depression, not the anxiety. But the Effexor works on both. You know, but the fact that you had some breakthrough depression, being on already the highest dose of Effexor, there was a chemical shift there. You know, and that can happen for no apparent reason. It just happens. You know.
Yeah.
So, but yeah, now that we've identified with this view, you're going to have clear sailing going forward. You know, you're not
I
going to
can't
have
imagine having a life thinking about the way I was before and not having this benefit.
But imagine there's so many people that never got the help that you got.
Yeah.
And that are living now, that live their whole lives feeling terrible. Can you imagine living like how you felt before and living the next 40 years that way?
No.
It's just, that's the reality of what really happens to people out there.
Yeah.
That's a lot of people's stories. And I mean, for example, I see guys from the Vietnam War, even the Korean War, so the guys in their 70s and 80s who have felt terrible for 50 years, 60 years. And I put them on something, you know, we've had several cases on the show, but I put them on something and they haven't felt this way since they were a kid, before they went to the war.
Yeah.
You know, and to me, I mean, for these people who suffered, who gave to our country, it gives me immense pleasure to treat them, because if I can turn their life around, at least, you know, and you know, at that age, you probably the rest of their lives, they're going to at least feel better, you know, and not suffer so much.
Right.
You know, so, you know, so that's why I love this job, and that's why. You know, when I saw you and I was doing family medicine, I like being a family doctor. I really enjoyed I liked pediatrics, I liked adults, OBGYN, all the whole thing I loved. But it you know, once I figured out Effexor XR, it changed everything for me. And then I saw everything differently going forward. And that's why about 10 years after I started practice, when I made a decision, I said I gotta focus on this, because there's a lot of family doctors out there, and that can help. I mean, I'm seeing things here that I can tell that other doctors aren't seeing, and I have an obligation. I felt a need and an obligation that I have to do this.
Yeah.
And that's when I started writing my first book, because I knew that I needed to get the knowledge out there, and I felt such an immense passion for it. And I still do. I mean, as long as I've been doing this now, I still get the joy and passion of someone like you coming in and doing a simple little tweak to the meds and getting results.
Yeah.
So
Changes people's lives.
yeah. And as a doctor, we don't go into this for the money. There's easier ways of making money than what we do. There's, you can, but we do it because, as corny as it sounds, we do it because we like to help people, and we want to help people improve their lives, and that's what drives most of us into it. I mean, I'm sure there's other doctors that go in for different reasons, but or it's expected in the family that they have to be one or whatever. With me, it wasn't any of that. I knew from an early age is what I wanted to do. And so and I'm glad I did, and I'm glad I'm doing what I'm doing. So
well, thank you for your help.
Well, thank you for anything else you'd like to add before we wrap up?
No, but I think if your mental state isn't good, I just think it's going to get worse, and who knows what that could lead to. Yeah.
Well, it can lead to some bad things, I mean, the worst is obviously suicide, but it can lead, if short of suicide, what's second worst to suicide is living a miserable life. Living an unhappy life, depressed constantly, anxious constantly, drinking all the time,
right?
Self-medicating. I mean, that's a life, unfortunately, a lot of people have, and it doesn't need to be that way. And my hope with doing this show, this TV show, is that to tell people that there's hope. You don't have to live the way you're living anymore. And you got to get rid of this whole anti-medication thing, because people, you got to realize it's not a weakness to treat this. It's a strength to treat it, because, it's a strength to be empowered to help yourself, and so I'm hoping with the show and my books that, that reach more and more people. So.
Well, thank you so much for what you've done for me.
Thank you, Linda. We appreciate you coming in so much.
Mm-hmm.
So in Linda's case, she's been a patient probably, she says 35. I don't think it's that, because I've been only in bed and practice for 33. But obviously she saw me in the early 90s because, or during the 90s, because that's when I was doing family practice. But again, I put her on Effexor XR because that was the miracle product at the time. And it just changed her life. And she was getting a lot of irritability and just mood, and so basically Effexor XR is an SNRI. So and she responded quickly to it. So again, it's working on serotonin and also norepinephrine. And again, both of those chemicals are now moving the right way, not the wrong way. And again, she responded quickly, but eventually we end up increasing the dose, and she's been at 300 milligram, which is the maximum dose for a long time now. And I last saw her before she recently reconnected with me. I saw her about 10 years ago was the last time, and she was following with her family doctor, who just agreed to keep prescribing it for her. So I haven't seen her for a while, but she basically came back to see me because something was wrong, because I just felt that I started getting a little bit depressed again. Not as bad as before, but not as good as it was. So what she did on her own was increase the Effexor to 450. Now, I've seen doctors do it. I don't do it. I've seen doctors do it, but the maximum dose is usually 300. She did feel better. So of course my choice was to keep her as is, which is reasonable. Probably most doctors would do that. But I knew at the time, and when I saw her, that what was happening is that really there was a dopamine issue going on. And Effexor XR, when you get to a higher dosage range, it does work on dopamine. It's mostly serotonin and norepinephrine, but it does work a little bit on dopamine, but not a lot. So what I had her do is I had her lower it down to 300, and I added the lowest dose of Wellbutrin, because I really wanted to get more to the dopamine factor here. And once I did that, once we get dopamine, now we got serotonin, norepinephrine, now dopamine, and that right there, she said within a few days, which is how quickly this stuff works, she was feeling much better. And when I asked her, was it better than the Effexor 450, she said definitely. So that's probably where she's going to stay. Like I said before, when she was here, that might I have to increase the Wellbutrin a little bit more? Well, time will tell. But as of now, I think we figured out that just this combination, the dynamic duo, is going to be the right combination for her moving forward.